Let's welcome back Dr. Oliver to our program. And Dr. Oliver, as you mentioned earlier in our conversation, you're a grad of the UNC School of Medicine, so extremely familiar, obviously, with the medical school up in Chapel Hill. We do have a Wilmington branch. Why don't you talk about the partnership with the community here in Wilmington already and how we can further that conversation and expansion here of the Wilmington campus?
Well, thank you so much. This is really exciting for me to be able to work to bring more to the medical education program that already exists. We hear so much from the team locally and from the community about how much they value the partnership that they have with the UNC School of Medicine and did not want to see that go away. And so we are very happy to be able to partner with UNC to continue and to grow all that they currently bring. So the UNC School of Medicine currently has medical students that do rotations during their third year and fourth year in the Wilmington area. And this is an opportunity for us to continue to grow that. So we bring more students to the area, that we expand research opportunities for the people of southeastern North Carolina through this relationship, and that we evolve the clinical care so that we can improve access locally, especially in areas such as pediatrics. By offering all of that, in those three key areas, so expanded education and training at the Wilmington branch of UNC School of Medicine, the research, clinical trials, and population health studies, and then investing in local clinical care specifically related to pediatric subspecialty care. It does nothing but improve the overall health and standing from a health perspective of all of southeastern North Carolina. And I think that's pretty remarkable and will position that area long-term for success, because we know that we're facing challenges with recruitment and provider shortages over time. The more that we can do to provide a pipeline locally where people will come and we know it's a very attractive area for people to live, and we can get them there, we can keep them there, and the people of Wilmington can ensure that they have access for long-term.
Dr. Oliver, let me ask you, when we talk about clinical trials and population health studies, we'll discuss a little further as to what that exactly means for the everyday person out there that may be not intertwined in the medical practice. But why is it important? And just give us a brief synopsis of what some of these things actually mean.
That's great. So when a lot of people think about traditional research and clinical trials, think about drug studies or cancer studies where there's a new and novel and treatment that is being tested, not necessarily at a stage where they're seeing if it's safe, but refining protocols and being able to be have access to maybe some aggressive but proven treatments. And that's what we traditionally think about. And UNC has a significant amount of research related to clinical trials that current state, the people of the Wilmington area would probably have to travel to the Triangle to be able to participate in some of this. And so our idea with UNC is that we will develop the infrastructure from both from a support, personnel, and technology to be able to offer more of that within the local community, so that there is just more access in general and it's more convenient. We know that within the United States, people of color, such as African Americans, the Latino population, and Native Americans, are underrepresented when it comes to clinical trials. And that is especially difficult in rural populations. And so we aim to be able to increase that access and communication and education around this to bring more of the population from southeastern North Carolina into clinical trials where it's appropriate. And then lastly, there are many issues that have been identified by the community as key focus areas, whether it's related to health equity or the opioid crisis, that population health studies and other initiatives for improvement in care, et cetera, would be included in this research opportunity that we jointly with the existing New Hanover team, the CHEC team, and UNC would grow together to be able to benefit the entire community.
Dr. Oliver, as I let you go here today, Dr. Pam Oliver with us. She's the Executive Vice President and President of Novant Health Physician Network, getting a better idea as to what the expanded partnership with UNC Health and the UNC School of Medicine will look like when commissioners ultimately vote on this, and with a partnership likely moving forward. Once again, it was on July 2nd that the Partnership Advisory Group recommended that New Hanover pursue a partnership with Novant Health, the UNC Health, and the UNC School of Medicine. That recommendation approved by the Board of Trustees at New Hanover Regional and then the Board of Commissioners mid-July. And this agreement is now getting drafted, outlining the goals of the healthcare system, the priorities of our community. We're hearing about some of those here today with Dr. Oliver. Ultimately, a public hearing will be scheduled ahead of this final vote, which is expected sometime in October. And Dr. Oliver, as I let you go, you talked a lot briefly about pediatric care and the need to improve that as identified by members of our community here. How does this partnership improve local pediatric care for our children across the region?
So, the general pediatric care exists in many markets, but the access to subspecialized care, which would be specialists such as cardiologists and gastroenterology or genetics, hematology, oncology, developmental and behavioral health specialists who really focus on children, can be difficult in lots of markets. And so we will use our relationship with UNC Health to help recruit faculty and full-time personnel for many of these specialists who will live and work on-site within the southeastern North Carolina area and in Wilmington. And that, again, is highly is very important when it comes to access and families not having to travel hours to be able to receive that type of care. And where we can't bring someone, it may not be feasible to bring someone on site, then UNC has committed to expanding telehealth or even part-time, periodic access, and being able to provide that from Chapel Hill where needed. So, cystic fibrosis, inflammatory bowel disease, those are all areas that some of our outlying markets and areas can struggle with getting care. And we know that team can recruit high-quality physicians and APPs who can continue to evolve the general pediatric service line, clinical service line partnership at New Hanover Regional Medical Center.
Dr. Pam Oliver with us from Novant Health. She serves as the Executive Vice President and President of Novant Health Physician Network. A lot of great information out here today. Dr. Oliver, thanks so much for the time. What was that website again that you mentioned at novanthealth.org as far as where people can go to get a little bit more information as to what you do and why you do it?
Great. novanthealth.org/Imagine Better.
That's at novanthealth.org/Imagine Better. Dr. Oliver, it's been a pleasure, and I look forward, of course, to future conversations. Should this move forward in the next several months? I know this is just kind of the tip of the iceberg as far as all of the information that you want to continue to get out there. So really the community has a great understanding of this undertaking and what it means for them as it relates to their health.
Thank you so much for having me. It's always a pleasure to be in conversation. I look forward to working with and getting to know you and the rest of the community soon.